Hello and welcome back to Autism is Real. My name is Maria Havari and I'm your host for next 30 minutes. Question asked by parents of any age group in America today: is autism on the rise worldwide? How many does autism affect? What are my chances of having autistic child? And how common was and is autism today and in 2018? I am going to try to answer this question rather quickly, and here we go. The ongoing rise in autism and what in the world is really going on when it comes to autism, especially in America. Autism spectrum disorder is a lifelong developmental disability. It's characterized by problems with communication and social interaction with accompanying repetitive behavior pattern. There is also intellectual disability. There is some statistic done that, for example, in 2004, 1 out of 125 children were autistic. In 2000, they were diagnosed with autism. In 2006, 1 out of 110 children. In 2008, 1 out of 88 children. And in 2010, 1 out of 68 children. As I'm sitting in front of camera right now, today is 1 out of 40 children are seriously suffering from autism, and they are within the spectrum of autism disorder. Quote, CNN, a survey of parents across the United States, estimated that 1 in 40 children has autism spectrum disorder. And the study has showed in published, and it showed and it was published in the Medical Journal of Medicine, Pediatric Journal of Medicine. In other words, the condition was reported as 2.5% of children, representing an estimated 1.5 million kids aged 3 to 17 are autistic. And they are suffering on their day-to-day life. They are suffering from this horrible, horrible disease. And we compare that with Down syndrome and other behavioral disorder. Parents are really anxious, and parents at the same time are very disappointed. They are getting unacceptable delay in getting diagnostic evaluation when it comes to their children. Teachers, caregivers, you name it, professional out there as well as parents who are dealing with this individual with disability, they are seeing the sign of autism in these children or adults, but they are not diagnosed. When they approach the neurologist, pediatric, psychologist, psychiatrist, and so forth, there is a delay. They don't help them. There are a lot of questions about medicine. The impact of medicine on autism. What does really medicine do when it comes to the ordinary brain, let alone to the brain of autistic individual? Today I'm lucky enough to have a guest at our studio. His name is Nathan Mayer. Nathan is a pharmacist. He also has an academic background from University of Michigan. Welcome, Nathan. I would like you to tell us a little bit about your background, tell our viewer about your academic background, and then emphasize on some of the medicine, as you know, when it comes to psychiatric behavior, psychiatric medicine.
Fantastic. Yeah, thanks for having me today. I appreciate it. Glad to be here. Glad it's warmer today. It was a little bit chilly the past couple of days. But yeah, my background, so I've been a pharmacist for 10 years. And as Maria mentioned, I graduated from the University of Michigan, and I've had a diverse background of pharmacy experience. After I graduated, I went to school, or I worked in Austin, Texas. And I worked there for a few years in Walgreens. And then also after that, I worked in a hospital, and then met my wife, who was from Beijing, China. I had a wedding in Beijing, and we lived there for 5 years. I thought it was going to be a couple months of vacation, and it turns out to be 5 years. Mm-hmm. But
so you actually work at the pharmacy. You had pharmacy in China for 5 years.
Well, initially that wasn't what I ended up doing. I was on a radio talk show for a little bit. I taught English, and ultimately realized, I have a pharmacy background and worked for a drug company. And I worked in regulatory affairs to help bring drugs into China that were approved in other countries.
So Nathan, with your academic background, is there any medicine that when it comes to psychiatric treatment and autism specifically that you can emphasize right now and talk about a little bit about the pros and cons, disadvantage and advantage of those medicine? I know for a fact as a mother you cannot give medicine to autistic individual just to put a smile on their face or to make them be smarter or things like that. So can you emphasize on some medicine?
Yeah, I can absolutely emphasize on some medicine. Before getting into it, one thing I want to mention is medicine's not going to treat autism, number one. Number two, not all symptoms of autism can be treated with medicine, and I'll go through those. Medicines have side effects, and medicines they can be expensive, so it's something to consider before getting on medication. The symptoms that are not treatable are not able to follow directions, poor social skills, slow learning, and but symptoms that can be treated are things like hyperactivity, aggression, sleep problems, tics. So medicines are able to help with these problems. And getting to your question, there are 5 main classes of medications that children or people with autism can take. One of them being, I'll go into detail, are stimulant medications. For example, Adderalls, Vyvanse is one of the medications, and these are used to help with attention, which a lot of cases children with autism have this problem. So that's a valid reason to use this medication. However, with that medication, there are side effects that happen. One of them being sleeping. And the issue with that is once it can turn into a vicious cycle where a child takes a medication for attention, but then they can't sleep. And a lot of times they might have to take a medication to help them sleep. And then other side effects may come across, for example, depression through taking these stimulant medications. And then on top of that, they need to take medications to help with the depression. So it almost turns into, you have to weigh the cost versus benefits of using it, where if the child really does need it, it's valid, but consider the fact that this can lead into a vicious cycle. Other examples are alpha agonist medications. One example being clonidine. Clonidine also helps with hyperactivity, impulsive behavior, and but with that, it does help, but there are also side effects associated with that too. Clonidine is actually a blood pressure medication. So if a child you have to monitor blood pressure, make sure the blood pressure isn't getting too low. Other side effects, sleepiness associated with it. Another class, anti-anxiety medications. A lot of them are the SSRI class of drugs. For example, Prozac, the brand name of Prozac, Zola, Paxil. These are drugs that can be used to help with depression, anxiety, repeated thoughts, repeating behaviors. But with that said, there's side effects associated with these. Could be common ones, GI effects. Sometimes there's issues with sleeping. Sometimes there's issues with staying up too late. So it depends on the medication, depends on the person, and agitation, weight gain that can be caused by this. Issues with suicide, thoughts of suicide. That's a black box warning for a lot of these SSRI medications. Rare case, serotonin syndrome, which is a very rare case that can happen through these drugs. Other medications that can be used are antipsychotic drugs that are used, and these are to help the issues with irritability, aggression, tantrums, sleep problems, and they're very effective for those. However, there's side effects associated with those too. Side effects could be sleeping, drooling, could be increased appetite or weight gain. Long-term effects can lead into diabetes. Long-term effects could lead into high cholesterol, tardive dyskinesias, which are shaking from these medications. And with that, a lot of times patients have to take other medications to stop that side effect. And the common theme here is that it's the cost versus the benefit of taking these medications. If it's helping these symptoms, it's good, but there might be a cost versus benefit. If the cost is too high, maybe it would be getting into another medication or decreasing dose or discontinuing altogether. The last class of medication are medications for seizures or mood problems. Examples are Tegretol, Depakote, Trileptal, or Topamax, and these will treat issues with some children with or people with autism have seizures. So obviously seizure medication is used for it, but it also used to be used for mood problems, can be used for aggression, self-injury, and issues with these are sleepiness. Some get nauseous taking these medications. More rare type side effects could be liver failure, bone marrow suppression, or issues with rashes. So.
For what I hear, they all have like 80, I like to say they have 70% benefit, 30% side effects. But it seems to me that when they prescribe this medicine to consumer or patient, they don't tell them about the side effect of the medicine. Here come a bottle of medicine with the printout, and the printout is so small, and you're supposed, whereas I think the role of a psychiatrist, which is a medical doctor, and they are the one who prescribe the medicine at Washington Community Mental Health or any hospital and so forth, they should tell the parent what are the pros and cons. They should tell the parent. If I've seen people who are not having a seizure problem or any other categories of that you mentioned earlier, but they've been given Depakote. Depakote is for aggression and for seizure. But Washington Community Mental Health, I mentioned that name a lot because for past 30 years I dealt with them. And I know so many individuals there in that entity, and they have a few psychiatrists that they are ongoing. They are always there. There is no promotion. There is not. They need to upgrade their knowledge. They need to train their social worker and psychologist. Even the psychiatrists themselves, because in our community, I see our dentists and our other doctor go and get their knowledge upgraded. They upgrade their knowledge, they update their knowledge. We have seminars all over the continent. But when it comes to psychologists, I don't see that. All I see at Washington Community Mental Health, they bring the pharmaceutical, bring a container with medicine, they approach a doctor, they do a little bit of presentation on the medicine. Next thing you know is in the prescription, and they try it, they experiment it on the count of the individual who is suffering from either Rett syndrome or bipolar disorder or Asperger, which is all autism, categories of autism. It is sad. It is very sad. It is really good to have somebody like you is there any way that you can train the psychologist and the psychiatrist who prescribe the psych medicine and the anti-anxiety medicine and all the other type of medicine, you tell them about the advantage and the disadvantage of this medicine. And not everybody, I know that they put my daughter in some kind of a psych medicine not long time ago. Her sodium level in her blood went so high that they didn't know what to do. They sent her to University of Michigan. University of Michigan Psychiatric Department is the worst place for children or adolescents who are suffering with autism, with this horrible spectrum of autism. They didn't know what to do. They kept her there for a week, and I think ultimately they find out that the medicine needs to be changed, the dosage of medicine needs to be changed. I don't know who gives the authority to a psychiatrist at any entity, whether it's a hospital or the community mental health or an adult foster care home or group home, to prescribe a medicine without knowing whether or not, like my daughter, need to be checked for her thyroid. And of course, she is in Washington County. Washington County, God knows how much taxes they collect. But when it comes to mental health, they are performing, it's very poor, the way they provide care and the level of training, which as a parent point of view, I think they should train on regular basis. They should train the social worker, they should train the caregiver, because ultimately from the top to the bottom is the caregiver who provide care for the individual, whether it's in hospital or group home or adult foster care home or waiver program. When they come to the parent's house to relieve the parent, for an hour or so, they need to know what is autism about. So you're saying that autism does not cure all this stuff.
Or the medication.
The
Yeah,
medication, when it comes to autism. What will happen if somebody takes the medication and then it damages their liver and it damages their kidney, and of course they're not able to tell about it? Does the blood work show that, or how often they should do the medical review? That's what my question is. At the community mental health, how often the medical review needs to be done?
So I'm going to recommend to anybody, have follow-up appointments, see your physicians, and ask questions, and have be knowledgeable of what's going on. Be knowledgeable of what these drugs are, what they're used for, and it's good to have an added voice and to be educated on what's going on, and to hear from multiple viewpoints. Read, hear from your physicians, listen to the community, and I know the community. I went to school here, and there's lots of great physicians in this area, and lots of great people who really are really knowledgeable on what's going on, and in seeking that knowledge and understanding what's happening. And I think that's going to be the most important. Have added knowledge, and that's what we try to provide to patients that we see. Is we try to provide them with education to explain what's going on, to explain. For example, if medication has a side effect, if that's something that's gonna eventually go away, or is that something that's going to stick around and medicine needs to be changed, or does that dose need to be changed? That's what we provide for educational. We can't make the changes, but we recommend patients to to address this at their next appointment, to empower patients to understand what's going on with medications and their health. That's our focus and what we want to do with our organization.
That is fantastic. I don't think we ever had any pharmacist in the past, as much as I know, ever since 1986 in Michigan, who actually sit in front of camera and tell the parent out there and tell the psychologists, psychiatrists and so forth, listen, I'm here. You can ask about the pros and cons of the medicine. You can text, you can email, you can have an appointment. One of the things that I observed in the past, and I can talk about myself because whatever I talk about, I talk to other parents, I read about it, I ask questions about it. I've been in a certain medicine for a certain period of the time, and say it doesn't work after the certain period of, like after 10 years, the medicine doesn't work, even though it's in low dose. Can they stop that right away? Can your psychiatrist or psychologist stop that and put you in a new medicine and expect that new medicine work? Or they have to gradually stop you from that medicine, the previous medicine?
So it depends on the medication. So for example, if it's like a depression medication, SSRI medication, that's a medication that you want to taper off of. That's a medication, if you're considering getting off of it, and that's something you want to discuss with your physician about, or your healthcare provider, to see if that's a good option. And getting off the medication, you talk to them, and tapering would be the best way to slowly, gradually get off of it versus just cold turkey getting off. And that's something you don't have the withdrawal effect, and it's something that ultimately you want to discuss with a healthcare provider too.
In the past, I've noticed that the common medicine when it comes to autism was risperidone, Depakote, whether it was required or not, they would prescribe that. and they wouldn't go by the individual's body to see whether their thyroid function, the level of thyroid in the blood work, or their kidney, their liver, or other, how much they weigh, how tall they are. They just prescribe that medicine, and whether or not the caregiver on those entities, whether it's group home or adult foster care home, do give those medicine precise. I personally think if medicine is combined with good diet, good nutrition, because all autistic children are suffering from one form or other form of allergies. And even as today, back then they would say thimerosal, mercury, thimerosal, mercury in the vaccine, and so forth. But now, with the rising number of autistic individuals, and a statistic that has been done in the past, and scientists, places that are more industrial, like Detroit, like Houston, Texas, like Los Angeles, compared to the other rural areas of America as a continent, the number of autism is higher than the places that the air is much cleaner, the water is clean to drink, and the diet is right. I think, so as a pharmacist, do you think the right diet will work with prescription better or not necessarily? You can eat junk food, or you can eat whatever you like, all not so healthy snack, and yet at the side take your psych medicine, take the other medicine to cure the side effect of shaking. I've seen people who have actually, their jaws are shaking, their bodies are continuously shaking, their hands are shaking. They can't sit still because of the side effect of all this chemical that pours into their bodies on day-to-day basis. And they think that's a quick fix. Give them the medicine and let them be. Never mind what they will feed them. Never mind what they eat for breakfast, lunch, dinner, snack. So do you think diet has a role as far as, I think diet is also a right food for stomach is also right food for brain, I think. Homemade food, what do you think as a pharmacist? Do we have to rely on the fast food out there, going to restaurant, buy cheap food? We know that good foods are expensive in supermarket, organic vegetable, organic fruit, and not everybody cooks. But I've noticed that, like I said, in past 30 years, I dealt with mental health, and they're supposed to have people who know how to cook, how properly wash the vegetable, the fruit, and to use them in proper portion. I think if you're giving medicine, psych medicine to your consumer, and it's prescribed by psychiatrist or primary care, you're supposed to make sure the diet is the right diet in order for the medicine to work. Do you think is the right thing to say?
Well, I think for anybody, it's important to have a good diet, to do exercise. And to say have a good diet is a very general statement, but do things. If you have an opportunity, try to use organic vegetables. Try to cook. And that's challenging for a lot of people because the cost. You mentioned the cost associated with it. When you're eating good, you're feeling better. When you're eating good, you and the question, the drugs and the medicine, I don't know off the top of my head on how that works, but I personally look at myself. If I eat better, I feel better. Mm-hmm. And getting outside of autism, if you're looking at people with chronic conditions like high blood pressure or diabetes, absolutely, that's an absolute connection between diet. and the disease. And I would go as far to say that for anybody, regardless if they're sick, regardless if they're healthy, is to continue to have a good diet, to continue to eat the right foods, to try to cook at home, and cook with healthy products, cook more vegetables. Mm-hmm. And my wife's Chinese. We eat vegetables all the time. We're not like the kung pao chicken that you see at the Chinese. It's very greasy and a lot of sugars, but with more vegetables and high nutrition.
Okay, great. I know that at some point I end up with a list of what should be for breakfast: oatmeal, banana, skim milk, soy milk for people for autism. Lunch should be broiled or a steamed vegetable of any kind, vegetable of season, fruit of season, so on and so forth. And believe me, it's cheaper, it's easier, and what we put in our body, it make a direct impact in our behavior, whether we are autistic or not. I look at the ordinary children when they keep giving them sugar, candies and all that. They are so hyper. They want to climb up the wall and up and down. And versus when they give them fruits and vegetable and other healthy stuff, they behave better. At the end, I want to say, just remember, 1 out of 40 children in America suffering from autism is a great many number, and it keeps rising. But keep in mind that these children are entitled to have, an adult, it doesn't matter, are entitled to have a happy, healthy, productive life. Is better for our community, is better in long run, and they are a major part of our community whether we accept it or not. So, and it's up to us to learn about autism. Hopefully in the future we're going to sit with Nathan and we'll ask more about question. In the meantime, there is a phone number and the address. If one of the cameras zoom on that information and show it to my viewer, that how they can get in touch with Nathan if they have any question in regard to prescription medicine as well as over-counter medicine. Thank you, and I say goodbye at this point. So long. We'll see you soon. Bye-bye. Thank you.